that to have, it was already discussed quite a lot, that these issues can't be solved only with a pure medical, especially pure biological, psychiatric point of view. It's quite complex. That you have to have around the table different kind of resort, like social education, justice, internal affairs. You need to have of course the all relevant stakeholders, including the family members, users representative, of course the professionals, but professionals can't domain, which is very often the case. That we still use the term psychiatry. It means like the psychiatrists are leading power. That's a very wrong, of course. It could be, of course, they have something to add. I'm not saying I'm also a psychiatrist. I'm not saying they are useless, but they can't be like a leading power, really. That's misunderstanding what has to be done. And then we very often struggle how to understand what's really going on. That we need to have a good data, but also how to interpret the data, just as we learned just now, that there is very often misinterpreting the data. That to have a good understanding what's going on, how much money we have in the pocket, how the money are allocated, how the way of allocation stimulate the behavior of the service provider, and what are the real needs, and what are the legal framework, what blocks, for example, how the money are allocated. Of course, it's also partly done by the legal framework. And then we need to have a really clear vision, which has to be based, as was discussed many times today, on the human rights. Of course, they're based on the content and context, on the evidence base, but human rights is the leading principle. This is the about human rights, as I said, Article 19, that the whole system is only good system when helps everybody to live where they want and are included as much as possible to the community. I think there is no other framework. Then, of course, when we have a vision, strategy, and some kind of the platform which is democratic way how to discuss the thing, then we have to go to how to implement the action plan. That we have to change sometimes legislation. Maybe sometimes we too much rely on changing legislation, and a lot of things can be done within the existing legislation. But very important is, as I said already, the rules how the money are allocated. That basically how the money can see what is needed and how the money follow the client's needs, which is very often the obstacle. That very often money follows the needs of the service providers. They stay with the budget of the hospital. Even hospital is closed, maybe then they go to another hospital, not psychiatric but general one. That's very important to have a whole budget and to know how to stimulate the proper behavior. And I think there is a lot of evidence this mostly the new services can be provided with more or less same cost than institutional care if we have those money, but there is some period which we will need some extra money, bridging fund, which exactly that's the structure funds could come on board and could help. Yeah, it will be very pity to use this, and I think you had the opportunity for 10, 15 years to use this money. That's I don't know how much wisely they were used, but I think that the structural funds are exactly the money which could be used not for running usual services, but like a bridging fund for transforming. And then again we discussed how we find out what's quality and how we will monitor it, but that's very essential to know where we go, if we go a really right way, and to have a good mechanism of feedback of the results to the planning. I think this is that you know already that every resource country can have a different, well, according to resource you can always do good community or good service. Even a very poor, very low resource country, when wisely used what they have, they could have very proper service. I was involved in Sri Lanka after the after the tsunami, and on the east coast, I think they developed. I was very happy to be involved. They developed, because of a crisis, such excellent service with nearly no money, which I think and that there were other parts of Sri Lanka which they got, because this one was Tamil, and they didn't have too much money. The other part, western part, they got a lot of money, and they develop bullshits. Yeah, they develop a lot of new institutions that sometimes, not to have too much money can help. That was very interesting. And not always money is the benefit. You can always create a good service. What is the vision? As was discussed here many times, and I start with my grandfather. Of course, the most of the needs has to be covered in primary health care. That we have to invest. That we have this good GPs who are supported by professionals. Sometimes maybe less support is better, because just not to medicate too much as we learn, but just to use the normal human, human understanding what the people need. Not to increase a number of sleeping pills and Zyprexa, whatever, but just to find a way how we can support and use the resources. And that's what the GP and primary healthcare has to be trained in. And then to have some kind of universal community mental health team with clear catchment area, with clear functions as discussed. A lot of oriented on the outreach work, crisis solution. My experiences, if you have a community team, they have 2 luxury houses. That's not good. They have to have some basis. But if people stay in the house more than 25% of their working time, that's not good. I think the 70% on the streets, just finding the resources, support the people, be in car, have a mobile, as you already discussed, of course, and to have a specialized focus on also on those who are just need this assertive. It means they are withdraw, or you have to find a way how to support them. I was working in such assertive outreach in the UK for 4 years. It was really challenging, and it can be done. I think it's also how you have the values of your team, and it was clear that the team atmosphere play an important role. If we have a crisis in the team or some kind of struggles, immediately number of people in a hospital increases. Yeah, that is some kind of like this studies of express emotions. That I think the team cooperation and team spirit is very important, and it works. You can keep nearly everybody out of the institution, and if there is a really good gatekeeping and good link between mental health teams and acute admissions, then you really can cut down this need of the beds quite a lot. That you need to develop. It was already discussed. Alternative of acute admissions. In Albania, where we work in some kind of project, also not having too much resources, nearly none resources, but we were special resources for mental health, but we were using primary healthcare nurses they have in the villages, the very remote villages, but in every village there was a little bit paid, not too much, but a little bit paid, one lady, like a nurse, and we trained them how to support the families. Yeah, we were just traveling to the villages and learn the mayors what it is prevention. And once I came to the one village they have, it was very rocky, they have only a couple of trees, and they had one man, he had the seasonal depression, and every spring he tried to hang himself. And when we discussed about prevention, then the mayor came to me very proud. He said, we made the prevention that he didn't hang himself this year because we take his rope and cut the branch of the of the tree. Then maybe we can do something more. What do you think? Well, maybe you can talk. Yeah, okay, we will kill the sheep and we will have the celebration if he's depressed. Yes, that's the prevention. Well, probably it could be part of the prevention. But likely they really understood that in that area, it was just Baba Tomori. It's a beautiful area, beautiful hill. That in the 3 years they had no admission to the acute ward, which was horrible and quite far, and we paid $5, I think, at that time, to the village if they have somebody with acute problems for 2-3 weeks. We didn't train them too much. I think they could find a way, and $5 was something, but not too much. That they didn't do it for the money, and that we can cut the admissions. What I'm saying, that you have to find the creative solutions which doesn't cost so much, and sometimes are much better than those who cost quite a lot of money. And of course, the social housing is an issue. Just not to put the people to shelter housing or halfway houses because there is no housing. That they need housing, and that you have to deliver the service according to actual needs, and flexibly what they want really. And essentially, it's just these people, as everybody else, need to have a good education and need to have a job, not a workshop. Or I think these social firms, it's probably not. Sometimes it could be good, but just a normal work, and how to find a way how the employers are open these people, to employ these people, and how we can flexibly support them. That's manageable. It can be done. Basically, that's also repetition what was already said. The model of community mental health team with all functions, comprehensive functions, I think is much better than to have a specialized team. And of course, that these teams has to be functional. They have to cooperate with all resources which exist in a community, and they have to be known by them, and other way around. I think basically, as it's a human being, then also in society, crisis is a situation when we see the way where we go, where we've been until now doesn't work, that we need to change the strategy. And I think the crisis can be really good start for rethinking of what we were doing and do it differently. Of course, it's better not to be in crisis, but if you are in the crisis, take it like an opportunity for restructure, a rethink, and take it like a positive start for the future. Thank you for your attention.